Hey, I'm Alyssa. I've been a youth board member for 3 years, and this is a story of how we started our podcast.
With an established youth advisory board of nearly 35 years, there was a need for a more innovative approach to reach more teenagers about substance use prevention. In an effort to accomplish this goal, the Director of Prevention Services wrote a grant proposal to receive the equipment and software needed to start a podcast. In doing research, the Director of Prevention Services and our youth board coordinator, Jessica, found that there was no podcast out there that was specifically for teens about substance use prevention. The youth board was trained by a local podcaster, and in February 2022, the first episode of But They Don't aired. The name But They Don't came from the social stigma that people believed all teenagers will try drugs or alcohol at some point, but they don't. The youth board members research, produce, edit, and promote the podcast. Our youth board coordinator ensures that our research is sound and from credible resources before we record each episode. While our podcast is not strictly about the danger of fentanyl, counterfeit pills, and xylazine, 10 out of 70 of our podcast episodes have been on this topic. We frequently revisit this topic to keep it in the forefront of our listeners' minds. In fact, we're here today recording an episode to start a new series titled Fake and Fatal, which will be a 3-part series on fentanyl, fake pills, and xylazine, an overdose response. In the past, we've interviewed local law enforcement narcotic officer and a local parent who lost their child to fentanyl poisoning. These interviews are part of a series on our podcast we will call Community Conversations, where we interview local community members on various topics. Here are some highlights from both of those episodes.
We know that the drug dealers are using fentanyl to make it look like fake pills or real prescription pills. Why is that so dangerous?
That's a great question. Before I dive into the fake pills, the first thing I want to say is all prescription medication, all medication in general has its own threats to health and safety. That's why anytime you see a commercial about, hey, we have this new drug that has the capability of treating or preventing all of these illnesses, what do you usually hear right after that? But could lead to, and you hear this list of side effects, ultimately with one of them being death. So any drug has its own dangers. Those dangers are magnified exponentially if they're used outside of the supervision of a medical professional. Okay? So first and foremost, even if it is not something that's being produced clandestine, it's not the fake pills, it is still dangerous and should never be used outside of the obviously the supervision of a medical professional. But one thing that makes these fake pills so dangerous is they're not being manufactured with any type of quality control. There are people that have some chemistry knowledge that are creating them, but the difference is those that are making these aren't concerned with the health and well-being of their consumers. There's no legal team that is working to prevent them from selling something to citizens in the United States that could ultimately lead to serious physical injuries or death.
And, he knew better, but he still took it. And so he quit breathing. He went to sleep, started snoring. Whoever, his friend that he was with that night, heard him stop snoring. They went to check on him. He wasn't breathing. So EMS was called immediately. They performed CPR on my son for an hour and 15 minutes before they pronounced him. And that would have included giving Narcan, and it just wasn't successful for him. His pills were laced with fentanyl, heroin, cocaine, and meth. And those were not pills. I mean, that's not drugs that he did. And from what I understand from the coroner, is that when you see those multiple medications like that, those are always in the pills. They're not drugs that they just did on the side.
If you want to start your own podcast on substance use prevention, one of the main things you need is a strong adult mentor. Jessica, our mentor, is always encouraging us to think outside the box to reach our peers, which is why we even have this podcast to start with. Our next piece of advice is just start. We worked out a lot of kinks over the past 2 years, and we are finally getting into a good groove of what our episodes will look like. The tagline of our podcast is By Teens for Teens. Your voice is strong, use it, to let your peers know about the dangers of fentanyl and fake pills.